So instruction is a process, and it takes time. And I'd like you to think of the objectives as being progressive, that they will change and they will progress as you spend time with the student, as the instruction process progresses. We're going to talk about some tips on that intelligent teaching, so that time factor and how you actually make some of this happen without spending your whole night finishing the work you didn't get done on the day. And really talk about feedback and how do you do that effectively. So objectives will be a continuous process. What you should see is that the learner achieves objectives, and so you kind of retire those ones and you develop new ones. But what you should be seeing is steady progress to achieving the objectives that have been set out for the course and the other objectives you set as you and the student identify specific things that they need to work on. If it's not attainable, if for some reason they're not achieving the objectives and you thought they were reasonable and you thought the student was capable, then the question I encourage you to ask yourself is this something that really needs very structured remediation? So is it more than just they need a little reading, they need a little extra teaching? Is there really a problem that requires true remediation? And if there is, how do you know? How do you determine whether the student is progressing in the right direction or really isn't progressing and needs remediation?
By continuously sitting down with them and reviewing that objective and going through their progress through it multiple times over the course of the workshop.
You got it. Exactly right. So you're going to keep observing them. You're going to sit down and have those discussions with them on their progress. You're going to keep giving feedback. But again, if you're not seeing quick progress, then I think you have to really think about, does this need more structured remediation? And that's the time to call the clerkship director. Please don't hesitate to do that. Part of our problem as teachers of students and residents is we're too nice. We give them too many chances. And it's understandable. We know it's a tough process, right? We've all been through it. It is not easy to go through medical school residency. The profession that we have and the care we deliver is not an easy thing to do day in and day out. And so we're trying all we can to help them along without being too threatening and too difficult, and we're not allowed to throw anything at them. So,
Paddling allowable?
No. Failure is, though, if they really don't get it. We don't like to do that, right? We don't want to fail them. Well, you can throw things, you can throw things, but don't throw them at the student. So do it early rather than late. And nip it in the bud, right? Get it early, so that if you really have the concern that something isn't quite right, pick up the phone, send an email, get in touch with the clerkship director. Because if a student is truly having difficulty that is difficult to address, you're probably not the first person to identify it, but you may be the first person to say something. And so the challenge we have in medical education, especially where medical students they're in a different place every month to 6 weeks, is that continuum is difficult to follow. So the clerkship director will often know, so if someone else had been concerned but just didn't have enough information, the clerkship director will know that. And so you adding information helps them to decide, what do we need to do so that the student can progress? What do we need to do so they can be supported and they can learn differently? So don't hesitate to ask, don't hesitate to get in touch. Intelligent teaching. That's what I like to call this, because it's a way of helping us negotiate some of those challenges like time. So one is to keep in mind, do tailor things to the learner. And again, it's why you want to know the objectives when they come to you. It's why you want to keep setting objectives, so you can tailor the experiences and the exposures. Please feel free to select patients. They don't have to see every single patient. It's okay. I mean, what we often forget, what I forget, is I didn't learn everything that I know at this point in time in one day. It was a process. So for all of us, it was seeing over many years, lots of different patients, lots of different problems. So they don't have to see everybody. You can select what you think is going to help them achieve their objectives. And you can reassure them that it's going to be okay. They didn't see everybody in the office today. It's okay. They have tomorrow. Just a reminder that they should not have direct patient care unless you're available. Now, you don't have to be in the same room, but you do have to be available. Because the reality is you, as the licensed physician, are ultimately responsible for what happens, and only you can bill for the visit. Feedback does need to be frequent, but it doesn't have to be paragraphs at a time. And we'll talk about some specifics about feedback. Have the student keep a log. They actually have to some point. They have to keep track of what types of patients they're seeing. But you can have them do more than that. It's okay to ask them to do more, even if they give you a little bit of a difficult time about it. Because it's a way for you to assess their progress. And remember, we talked last time about adult learners, the shared responsibility. This is part of the shared responsibility. They can keep track of who they saw. They can keep track of what things you've discussed and what you still need to discuss. And that helps with that timepiece of it's not all up to you, it is up to them as well. A reminder to make sure you check and sign off on anything that they document. So if you're having them document in the chart, whether it's paper or electronic, making sure that you've signed off on it as well. And this is the one that helps me the most, the prolongation. That helps me with the time issue, because I'm one of those, you're no surprise, right? I could go on all day, right? So, to keep it under control so I can get home and have dinner with my husband, which he likes, the prolongation helps me. So, if you think about it, if the student learns one thing, just one thing on each patient, by the end of the day, they've learned at least 10 things. By the end of the month, they've learned probably 400 things. And so it really does all add up. So if they can learn just one thing, you're doing great. Ways to make those encounters happen. So we sometimes talk about modified shadowing. So the student essentially coming with you. Now, clearly they want to have hands-on and they should, but there's value to them watching you. And if you have a concern about a student's skill, whether it's how they take a history, whether it's part of physical exam, whether it's a procedural skill, having them watch you first can be the best way to give feedback. So they've done it, they've presented the patient, but you had some concerns about their history taking. So now you ask them to watch you gather whatever that focused history piece was where they had difficulty. And then you can ask them to explain the difference. So what was different about how I obtained the history and how you obtained the history? So it can be a very good way for them to see how to do things better and do things well. Thinking about how many encounters they can see. So if you're in the office setting, you certainly want to tailor it to where they are. Now you're going to be getting third-year students in the middle of third year. So in an office setting, they should really be able to see about 6 patients a day, plus or minus, as going in there first, without getting it too backed up in your office. Okay? In the hospital setting, they should really be able to carry a load of 4 to 5 patients that are primarily theirs, again, depending on the complexity of the patients that they're seeing. And so letting them go in first, present to you, and then going back in with you when you actually go in to do your focused part of the exam, history exam. Pointing out specific skills that you want to watch them do. So you don't have to watch them do everything on every patient. You can certainly decide what is it that you want to see them do on a specific patient. And that again helps with that time piece of it. And then the student should write their note. Now if you choose not to put it in the official chart, that is fine. But still have them write it on paper, because they do have to learn how to document. And so your review of that, your feedback helps them to learn how to document. And with electronic medical records, it's actually become a problem. Because some offices and some hospitals aren't letting them document in the electronic record, so they never document. So it turns out that it's important for them to do. So if they can't do it in the official chart or the electronic, have them do it on paper. And you learn how to do that. And then again, you must document because the billing is based on your documentation. You can refer to the student's documentation. So past history, social history, family history, you don't have to repeat that, you just have to verify it. You can also use them as a scribe. You just have to state that that's what you did. So you can let them essentially write it all down, use them as a scribe. You have to ensure that you state that at the end of your note and that you verified the information. Keeping it brief, so even in the discussion, as you said, 3 minutes or less, You do want to occasionally have them do the entire presentation, so you can make sure they can reason and synthesize and analyze and come to appropriate diagnoses and management plans. But they don't have to do that in every patient. It's completely up to you. It's okay to just say, you know, on this patient, I just want you to present this portion to me. And that's fine to do. And the other beauty of the Socratic method is it helps them think out loud. It helps them learn to reason and analyze. So it's partly about you sorting out what they know and what they don't know, but it's also them gaining that cognitive skill that we have of analyzing and synthesizing information to come to diagnoses, and based on the diagnoses, come to management. Again, frequent observation, but again, a pro patient. If you watch them do just one little thing on half the patients in a day, by the end of the month, they have will have done the whole scope of things. So why? Why do you want to observe them? How does that help you?
How else are you going to evaluate them?
It is going to be, it's really the only way you know what they know how to do and what they don't know how to do. Yeah, that kind of sums it up. So I'm not going to make you do the whole list. So that is really the only way you're going to know what they're doing. Keep in mind it does some other things. So it communicates to the learner that you're interested. The fact you took the time to stand there and watch them lets them know you're interested. Not that they should doubt that, but it's confirming to them. As you said, it's the only way you're going to know their ability. It's the only way you're going to be able to evaluate them. It's also important to the patient because it confirms the learner's importance. And I think you'll see that quickly if you haven't already seen that when you've had learners, that patients really appreciate it. And I find the patient loves it when I do the questioning in front of them because they're getting all this information they don't usually get. And so it really ends up being beneficial for both the patient and the learner. And again, it reinforces your active role. That it's not just giving a grade, it's not just filling out a form, but you're really involved in the teaching process. It does take time. Again, so do the pro patient, select a few. You don't have to watch everything. Pick a few things, do it based on what you have for the objectives, the course objectives as well as the objectives that you set with the student. When you do need to give feedback, the simplest feedback is what we call active watching or video recorder. You just describe what you saw, and you can make a brief comment about it, and then later, if it needs more feedback, you can do that at another point in time. Again, asking the learner to observe you, a great way for them to make their own comparison about their ability versus your ability. And keeping notes, because by the end of several weeks, you're trying to think, okay, what did I, how are they performing 2 weeks ago compared to now? And again, they don't have to be like your chart notes, but just enough notes that you're able to tell where is the student progressed, where are they not progressing and need some extra attention. Procedure. So have any of you taught procedures to learners before? Probably when you were residents, maybe. Yeah. So think back to the best examples. So the best teachers you had and the times that the person you were trying to teach did it really well. I'm going to bet these are some of the things that happened. So what we suggest is that you identify those procedures and actually try to do that up front. Once you start looking at the clerkship goals, what are the specific procedures that need to happen during the time the student is with you? The time it's going to happen, actually describe it before you ever do it. And it's another good way for the patient to hear what you're going to do as well. So before you do anything, before you demonstrate anything, it's when the learner can really focus on the information, talk about the purpose, why you do it, the indications, how you're going to do the procedure. Then while you're doing the procedure, point out the landmarks, the fine points, but don't quiz the student yet. Afterwards is the time to talk about complications, to ask them questions about the procedure and the information you told them. And then summarize the relevant points for them. And then, or having them do it, that you describe it or have them describe it out front. Demonstrate it, re-describing it, and then afterwards have the learner answer your questions, discuss it in more detail. Because if you think about it, when you're first learning a new procedure, you really can't concentrate on what the procedure is and the technical performance, and at the same time think about complications, indications, all of that stuff at the same time. I also want to encourage you to share your life as you feel comfortable. All of those other hats you may wear. I think for our students, it is going to be a huge advantage to be here at Good Shepherd because one, they will get a lot of attention, and two, I'm convinced that you're really going to invest in them, and three, I think you're really going to find it fun and worthwhile. But other things that you do, are you the school doctor? Are you involved in some community projects or education programs? Are there other things that happen in your office that they can get involved in, or responsibilities that you have that may not be only about direct patient care? Sharing your perspective on practice, the parts you feel comfortable sharing about your life and the decisions you made and how you make this work in your life and your family. And are there other meetings, if there's committee meetings that it would be okay to bring the student to with you? Other organizations that you're part of, so that they really start to learn about life as a physician and how do these pieces fit together. So please feel free to do that. Any questions so far on that part?